Our speaker will be Ms. Kimberly Roberts. She is the Maternal Mental Health Program Coordinator for Healthy Mothers, Healthy Babies Coalition of Georgia. She started with the agency in January 2021 and oversees a newly designed Ran for Moms by Moms peer support program. So Ms. Roberts was born and raised in Atlanta, Georgia, and is the mother of 3 tweens/teens. Ms. Roberts holds a master's of social work degree from Clark Atlanta University and has an extensive history of working in the health/mental health field. So welcome everyone, and go ahead, Ms. Roberts.
Thank you so much, Amber, and GSU for having me. This is a great opportunity for me to not only teach you guys about my craft and my skill, but also enhance my craft and skill. As I say, I just started in January with Healthy Mothers, Healthy Babies. So throughout my presentation, I'm just going to tell you a little bit about Healthy Mothers, Healthy Babies, and services that we offer, provide you guys with some statistics as it relates to maternal and infant health, and also kind of give you a breakdown of our parent-facing programs that we offer in the community. As far as any questions may go, please hold all of your questions or place them in the chat box. And I believe Amber is going to help me out with that. And we'll address all of those questions at the end of my presentation. So I look forward to speaking with you guys, and I hope you guys enjoy. All right. All right, Amber, can you see my screen, or everybody can see my screen okay?
Yes, I can see your screen. If anyone could drop in the chat if you can or cannot see the screen, just let us know. Yes, Alexandria and Will said yes, so go ahead.
Okay, great. All right, again, my name is Kimberly Roberts, and I am the Maternal Mental Health Program Coordinator for Healthy Mothers, Healthy Babies Coalition of Georgia. And today I'm going to talk a little bit about inspiring maternal mental health. For over 45 years, Healthy Mothers, Healthy Babies Coalition of Georgia has served as a nonprofit with a fierce commitment to improving maternal and infant health. During these unprecedented times, we recognize just how critical it is not only to provide direct resources and education to families, but also bolster the workforce and reduce systematic barriers to ensure that every mother and child has access to resources for a healthier life. So I'm going to talk a little bit about our main 3 pillars, which is resource access, advocacy, and education. Healthy Mothers, Healthy Babies Coalition of Georgia is the only organization in Georgia that focuses on the full spectrum of maternal and child health concerns from prematurity to maternal mortality. Our mission is to improve maternal and infant health through advocacy, education, and access to vital resources. Our vision is a Georgia where every mother and baby has the resources and support to be healthy and thrive throughout the perinatal period. Resource access. On behalf of the Georgia Department of Public Health, HMHB Georgia operates the Georgia Family Health Line, Children's First, High Screening Line, and Help Me Grow Georgia to provide callers with appropriate referrals and resources across the state. HMHB Georgia also operates the Prevent Child Abuse Georgia Helpline on behalf of Georgia State University. And also they partner with the Department of Family and Children's Services as well. We are pleased to serve as a resource and referral agency. Our dedicated call center staff are highly trained and responsive to the needs of those we serve. Advocacy. In a nonpartisan role, HMHB Georgia engages with legislators as well as medical, business, and other community organizations to encourage fiscally responsible policies that promote access to care and improve outcomes for women and children. Education. HMHB provides evidence-informed prenatal education across the state through collaboration with other community organizations and clinicians. HMHB also works to educate and build capacity for healthcare providers and public health professionals working in a maternal and infant health across Georgia. Later on in the presentation, we're going to talk a little bit more about our education portion, and which includes our 3 parent-facing programs, which is our Pickles and Ice Cream of Georgia, our peer support program, and also our new affiliate, Parents as Teachers. Just a few statistics. Georgia has the second worst maternal mortality rate in the United States. About 1 in 3 pregnancy-related deaths occur 1 week to 1 year after delivery. Postpartum is such a vulnerable time for women. It is not just vulnerable for mom and her body as it tries to heal, it's also vulnerable for her mind and emotions. Maternal mental health is just as important as physical health. This information was obtained from America's Health Rankings. All right, let me talk a little bit about our first parent-facing program, which is Pickles and Ice Cream, a project of Healthy Mothers, Healthy Babies of Georgia. Available through the resource site, Pickles and Ice Cream, are prenatal and postpartum education classes, breastfeeding classes in English and in Spanish, and baby care classes, which are all led by professional childbirth educators, doulas, lactation consultants, and other community members. You may also find support groups for moms experiencing emotional and mental difficulties led by trained moms, facilitated, and which I will discuss later in the presentation. What is Pickles and Ice Cream? Pickles and Ice Cream Georgia is a project of Healthy Mothers, Healthy Babies Coalition of Georgia, a nonprofit organization dedicated to improving maternal and infant health outcomes in the state. PNI is a parent-focused resource site focused on providing friendly, accessible, evidence-based pregnancy information and resources to expecting moms. Kind of just broke that down a little bit prior. We also give out toolkits and postpartum care packages to moms in the community as well. Just some statistics that were obtained, also from America's Health Rankings, and an initial project prior to Pickles and Ice Cream beginning, we kind of pooled and asked about moms and the services that they may have received in the community. And our findings resulted in 82 to 90% of Georgia women do not receive in-person prenatal education outside of their prenatal doctor's appointments. Georgia has some of the highest maternal mortality rates in the United States, 48 out of 50. 79 out of Georgia's 159 counties do not have access to obstetric care. 50%, over half of pregnant women with depression were not treated. Ages 19 to 44 is the high percentage of uninsured women in Georgia. 6% is the increased low birth weight for babies in Georgia over the past 2 years, ranging from initially 9.5% to 10.1% of live births. All right, so part of our Pickles and Ice Cream platform, you would find, in addition to our evidence-based classes, we publish blog articles every month. All of our blogs are reviewed before being published to make sure that this information is correct and also written in a language that is easy to understand. As you can see by the titles, there are a series of lighthearted topics and serious topics to choose from, including toy time safety, you're not alone, support groups, the truth about preterm birth, rub-a-dub baby, baby's first bath, everything you need to know about SIDS, just to name a few. We also produce videos and quizzes as another fun way to disseminate important information. Videos and quizzes are also published monthly by HMHB Georgia. Our most recent video that just came out is Safe Sleep. And our one for the month of April is about car seat safety. So that should be very informative as well. And also the quizzes, they're pretty fun. Am I ready for pregnancy? Oh, baby shower. What types of items would I have at my baby shower? And for our younger mothers, period or pregnant, am I just hormonal or am I getting my time of the month? Who knows? Um, so they're very, like I said, very easy and very easy to understand and check out. All right, so Pickles and Ice Cream. Pickles and Ice Cream basically has all the information you crave. I hope that Pickles and Ice Cream Georgia will be able to give expecting moms all of the information they crave from pre-pregnancy to postpartum. Have you or do you know a mom that has ever felt sadness, overwhelmed, distracted, anxious, isolated, agitated, helpless, or stressed? I sometimes feel like that today. But as it relates to our moms and pregnant moms or postpartum moms, these are signs of what we call perinatal mood and anxiety disorders, which you may know as postpartum depression or prenatal depression or anxiety, um, baby blues, bipolar disorder, postpartum psychosis, grief reactions to those moms who may have unfortunately had a loss, acute stress reaction, postpartum exhaustion, just being extremely tired and overwhelmed with dealing with all the realms of becoming a new mother. And also endocrine disorders, which can be affected, as it relates to diabetes and hypertension or hyperthyroidism. Although these names and diagnoses are very formal, we do not use this language when we talk on our Pickles and Ice Cream site or in our support groups. We try to keep any language we use very easy to understand to promote the idea that any mother, whether she has a formal diagnosis or not, is welcome for all of our information and services. Just a few interesting facts about our perinatal mood and anxiety disorders. Perinatal is not only postpartum, it is also pre-pregnancy, which is also known as antepartum, and also postpartum. Let's see. They can occur at any time during pregnancy or even after a mom has experienced a loss. Um, PMADs may occur up to 2 years after delivery, as most people only think it's up to about 6 months. So postpartum depression, anxiety can last up to 2 years after you have give birth. And also, dads and other partners also experience stress, anxiety, and depression. So it's important for us to make sure that we think about their needs and their concerns as well. Um, so I'm going to talk a little bit about peer support. Peer support is the program that I actually oversee. It actually started in November. We have about 7 groups right now. And these are our flyers and our rep cards that we distribute to our community providers. So I'll go ahead and tell you a little bit more about my program. To support the social and emotional and mental health needs of our community, HMHB Georgia is collaborating with the Georgia chapter of Postpartum Support International to provide a peer support program to pregnant and postpartum moms across the state. So my program is actually co-branded with Postpartum Support International Georgia's chapter. And I'll go ahead and give you a little background information on PSI. PSI International is the world's leading nonprofit organization dedicated to helping those suffering from prenatal mood disorders, the most common complication of childbirth. Their mission is to promote awareness, education, prevention, and treatment of perinatal mental health. Oh, sorry. Perinatal mental health issues affecting mothers, their families, and support systems in all areas of Georgia. Their vision is that every woman and family throughout the state will have access to information, social support, and informed professional care to deal with mental health issues related to childbearing. Their four pillars include decreasing the stigma of maternal mental health, improving access to care for all childbearing women and their families, to build informed collaborative network of partners throughout the state that work together to address perinatal mental health needs, and also to identify, secure, and leverage resources in support of perinatal health services across Georgia. PSI has members all over the world, including volunteer coordinators in every state of the United States, in the 50 states, and in more than 36 other countries. Um, PSI disseminates information and resources through its volunteer coordinators, their website, and annual conference. They provide current information, resources, education, and also advocate for further research and legislation to support perinatal mental health. Why do we need perinatal mood support, group support, peer support? HMHB Georgia and PSI believes that peer support is one of the best ways to fill this gap to help encourage and support women through their learning and recovery process. Group based peer support can be a promising intervention for pregnant and new moms as a means to both identify and manage emotional needs, thus encouraging positive maternal health and wellness. 1 in 5 women experience perinatal mood and anxiety disorders such as depression, anxiety, bipolar disorders, obsessive compulsive disorders, and those other disorders that I mentioned previously in the presentation. In Georgia alone, yearly more than 30,000 pregnant and postpartum women are likely to experience a perinatal mood disorder. While these disorders are very treatable, many communities do not have the trained providers who understand how to identify and treat mood and anxiety disorders. In addition, several areas across Georgia lack accessible, good quality support and treatment option for moms who are experiencing various trials of motherhood. So, with our program, all of our peer facilitators are moms, whether they have experienced post traumatic um, mood disorder or anxiety disorder, or they have not. Um, but we want them to work closely with moms who have had similar experiences. Our groups are not only for mothers with a formal diagnosis, but also for moms who are just experiencing symptoms or emotional difficulties and just needing someone to talk to. Our only requirement to join a peer group is to be a Georgia resident and to register on our website. Every single peer facilitator is a mother. There are no exceptions. All of our groups are free, confidential. There's no long-term commitment, online or virtual, with a phone and option available. You don't have access to the internet. Although you have a cell phone, you can dial in the number from your cell phone and you can talk in the group setting just as if you were there. All of our group dates and times have been layered to accommodate the needs of a busy mom. So as of right now, a lot of our groups are in the evening times, but we're leaning towards trying to accommodate our moms on the weekend and also our moms that are usually at home with our small babies during the morning. And we also use Zoom for our platform, which is very user friendly. Currently, we do not offer any groups for grief and loss, fathers and partners, or grandparents raising grandchildren, although our hopes for the peer support program is to add those services later in the future. One of my main target focuses right now is going to be teenage mothers, providing a support group for them. All right. All right, going to talk about a little bit about our target counties. So off to the side, you'll see a list of our target counties, which are Coweta, Rockdale, Randolph, Miller, Worth, Thomas, Clinch, Bryan, Chatham, and Effingham. Although these are our target counties, we still service throughout the entire state of Georgia. Most of the rural, underserved counties are in the southeast and southwestern area of Georgia. The darker the blue, the worse the adverse perinatal health outcomes are. Looking at the map, you may be wondering about the gaps or area where it seems we are servicing or offering the services. Our main goal is to service these highlighted counties and their surrounding counties and communities. These areas often share resources like hospitals, WIC offices, counseling services, and family collaboratives, you name it. So, in our outreach, we will focus on these counties first in their communities while simultaneously having the service open for any Georgian mom who needs support. So, our newest parent facing program is our perinatal case management, also known as Parents as Teachers. HMHB Georgia is a new Parents as Teachers affiliate. We are approaching the work using a collective impact model versus direct service, which is which most affiliate programs do. Through this model, our main goal is to do two things: support agencies, support agencies, wait, sorry, support or bolster the work of existing agencies and build community relationships. And two, offer home visiting services to families in counties who do not have access to perinatal case management services and the resources that it provides. So our goal with Parents as Teachers, we would like to serve at least 58 families in a 12-month period, 23 families with at least less than one stressor per year, and 35 families with at least greater than two stressors per year. Also, we would like to serve 87 children within the 12-month period from once we initiate the Parents as Teachers program. In our Parents as Teachers program, we are focusing on three additional target areas, which is Meriwether and Wilcox County. All right, so this is our contact information and Healthy Mothers, Healthy Babies of Georgia. This is our website. It also has our call center information line on the right-hand side, and also the coalition office line, which is direct access to all of our programs. And pretty much if you just need any information, this will be your starting point. Again, I am Kim Roberts, the Maternal Mental Health Program Coordinator for Healthy Mothers, Healthy Babies. I have provided my contact information. And on the side, I have also listed our Parents as Teachers Supervisor information, Ms. Lanayari Wilder, and also the Perinatal Program Coordinator, who pretty much oversees our pickles and ice cream program. Her information, Ms. Brichelle Parker, as well. And I'll leave that just for a second. If you need that information, don't hesitate to let me know, then I can pull this back up. And I want to say thank you guys so much for this opportunity. I hope it has been very informative, and thank you for listening.
Thank you, Ms. Roberts, for your presentation. Looks like we only have a couple questions so far. So our first question is from Jim, and he says, low dose aspirin is proven to prevent preeclampsia in guidelines from World Health Organization, ACOG, SMFM, all recommended the intervention for a select group of patients. The uptake rate is very low, probably less than 20%. Is your organization doing anything to increase the use of this simple, inexpensive intervention?
Unfortunately, I do not have an answer for that at this time. But I would love for you to put your contact information in the chat, Mr. Reachman, and I can get back to you. But at this time, we are not focused on a clinical standpoint. We kind of, want to make sure that things are kind of simply stated, and we don't want to take away from our clinicians and our providers in the community. But I will, again, I will verify this information, and I can get an answer over to you.
Alrighty, and the second question, also from Jim, is kind of similar. It says, California has dramatically lowered their maternal mortality rate over the last decade. They have freely shared the methods, toolkits used to reduce the maternal death rate, objectively measuring blood loss during childbirth and providing a blood pressure cuff to new mothers in the hospital are among concrete ways to address the two most common causes of maternal mortality. The question is, has Georgia tried to involve the maternal fetal medicine specialist from California to initiate a uniform effort to address the problem in Georgia?
I'm not familiar with any contacts or partnerships with California, but a lot of our programs are based upon the Lifeline program in Massachusetts, which are Pickles and Ice Cream and Peer Support Program all have been modeled from. And we obtained that assistance with that partnership with the Department of Public Health here in Georgia. But that's definitely something that we could definitely look into. And I'll be happy to forward that information over to my colleagues as well.
Alrighty, so I see some questions in the Q&A. I'm unable to see who typed the question, but our first is, hello, I was just wondering if there are any volunteer opportunities for students.
We do offer volunteer services. You can actually either send myself an email, or you can email our operations manager, Miss Mashonda Burton, or you can just contact our office line and just inquire about those opportunities.
Do you mind if I type your email in the chat real quick?
Sure, no problem.
Alrighty. Our next question is, are you all currently hiring for entry-level positions for undergraduate students?
You're welcome to check the website. I know recently we just did some hiring. As of right now, I'm not sure what's available, but definitely double check our website under if we're hiring or not and see what's available. But we're always eager to, get people that are willing to work and provide a service to our members in the community.
Let's see. Our next question is how do you group the peer group? Is it done by ages, time from giving birth, or the number of births?
There is no limit as to how our groups are organized. If you look on our website in under peer support, each of our peer support groups have offered a description. They're not geared towards anyone that is a certain age in particular. We're just, as long as you're a mom and you're having experiences or difficulties and you need someone to talk to, we just want you to come to our group. Like I said, one of my main focuses um, for the program, we want to cater some groups that are specifically designed for our teenage mothers. But as of right now, those teen moms can attend the groups that we offer currently as well.
Alrighty, and I guess my question is about any internship opportunities.
Internship, we do offer internships. Like I said, that would be another question for our operations manager, Ms. Mashonda Burton. But I also believe that they put internship opportunities available on the website as well. But feel free to, forward me your information, and I can definitely send that over, and you hopefully will get a response from her.
Alrighty, I think that's all of our questions. Does anyone have any last minute questions before we let you all go? You can just type them into the chat or into the Q&A section. You are to be commended for. Are you able to see the chat box, Ms. Roberts?
Yes, I see it. Evidence shows
Okay.
peer support works. You are commended for your efforts to put together a peer support program. Thank you so much, Mr. Richmond. And yes, our groups are evidence-based that it works, but you also have to work the program. So we just need our participants to attend, so we can kind of decrease some of these symptoms that are occurring out in the community. Just even when it comes to simple things, if you talk to someone and say, hey, I experienced that too, you experienced that, well, how did you deal with that? I dealt with it this way. You never know how you can be a helping hand for someone else off of the simplest statements that you may say.
Very true. Well, thank you, Ms. Roberts, for your presentation. It was very informative, just with, especially considering this is a topic that a lot of people don't really get the chance to learn about, but it's very important for people to learn about. So thank you again for your presentation, and thank you to everyone for joining, and enjoy the rest of y'all's day. Bye, everyone.
Thank you. Thank you so much for having me. I really appreciate it. And feel free to contact me with any questions or concerns.